Hello, everyone, and welcome to our financial webcast presented by Legend Financial Advisors entitled Medicare Open Enrollment. Take charge of your health insurance coverage. I want to thank everybody for joining us today. My name is Dan, the moderator for the webcast. Today's webcast presenter is Jim Holtzman, CEO and President of Legend Financial Advisors. Please hold as I turn it over to Jim.
Okay, everybody, it seems like I just did this webcast a few months ago, but it's already been a year, and the new open enrollment period is about to start, actually is starting. So let's first talk about what Medicare is. There's still confusion about differentiating Medicare and Medicaid. So the Medicare program is the health insurance program for people that are age 65 and over. The Centers for Medicare and Medicaid Services are the ones who coordinate this. Just to make it a little more confusing, the enrollment is technically through the Social Security Administration. So when you talk about Medicare and who is eligible for Medicare, basically everybody over the age of 65 is eligible for Medicare. And so defining that a little more is all U.S. citizens and legal residents who lived in the U.S. continuously for at least 5 years. So there are a few exceptions for this. Some people under the age of 65 can get Medicare if they also receive Social Security disability benefits. As we go through the webcast today, the focus is going to be for those who are reaching the age of 65 and over the age of 65. We will not focus on the disability benefit aspect of it, but it's important to know that there's at least that one exception. So the next slide is probably the most important slide of the webcast. And so what this does is it breaks down the way you can get access to Medicare. And there's two ways to do it. So on this left side is what we'll refer to as original or traditional Medicare. And on the right side is what's called Medicare Advantage or Medicare Advantage plans, and sometimes it is referred to as Part C. So we'll break down these into more detail, but kind of at the high level. With original Medicare, this is what most people think about when they think of Medicare. This is where you have Medicare Part A, which is hospital insurance, and then you have Medicare Part B for medical insurance, and we'll define these a little more in detail in a few minutes. And then you can add Medicare Part D, which is for Medicare prescription drug coverage. And so under Medicare, when you go through this process, this is where you can have what's also called a Medigap policy. Sometimes it is referred to as Medicare supplement insurance, but these are the same things. So that often causes some confusion between thinking there's a difference between a Medigap plan and a Medicare supplemental or Medicare supplement insurance, but they are the same type of plan. So when you go through what I'll call option 1 or traditional Medicare, that is what this means. It's Medicare A, B, D, and then a Medigap plan. So with Medicare Advantage, this is Part C, and it's one policy. And so when you think of Medicare Advantage, they're more like a traditional healthcare policy. It could be an HMO or PPO. And then within the policy, they will typically include Part A, Part B, and Part D. And that is most of the time. You just want to be careful and make sure the Part D, the prescription drug plan, is part of this. So for Part A, it's no different than what we just covered on the left side for traditional Medicare. It's the hospital insurance. The Medicare B is for medical insurance, and Part D is prescription drug coverage. But it's wrapped into one plan, and it functions like an HMO or a PPO, depending on the option you are to choose from. So with that, and we'll be referring back to this throughout the webcast. Let's break down the 4 parts of Medicare a little bit more. So you have the Part A, which is hospital insurance, and Part B for medical insurance. Both of these policies are provided directly by Medicare. Now, Medicare Part C, that Medicare Advantage plan, and Part D for prescription drug coverage is provided by private insurance. Now, the private insurer will have a contract with Medicare as far as making the whole system work to make sure everything is qualified appropriately, but your actual premium payment will go to a private insurer for Part C and D, where Part A and B, it's going directly to Medicare. Now let's talk about the enrollment process, because this can get very confusing. One of the main areas for enrollment is that if you are covered by an employer group plan that has 20 or more employees, then you must enroll in Medicare. This is unless you are covered by an employer group plan, pardon me. You must enroll in Medicare when you turn age 65. So again, unless you're covered by an employer group plan that has 20 or more employees, you have to enroll in Medicare. And we'll dive into this a little bit further. So what happens if you don't enroll in Medicare on time? So the first thing you want to be careful of is that you can have late enrollment penalties. Now, of course, if you don't enroll in time, you may have a gap. You may not be covered by insurance for some period of time until you sort everything out. And then beyond that, a lot of private insurance companies don't offer any private insurance for those that are 65 and over, because Medicare typically takes over. And then the late enrollment penalty itself is 10% for each 12-month period you could have had Medicare Part B, but you didn't. And that penalty stays with you forever. It's not like you enroll late, have a penalty, and it's a one-time charge. It happens every year. So as those costs go up, that also increases the amount of the penalty. And it's basically a lifetime penalty. It's another way to think about that. So you want to avoid that at all costs, just because you want to keep your premium amounts and penalty amounts. You want to keep the penalty amounts non-existent. And then, of course, the premium amounts you want to get in as soon as you can. Let's talk about how you enroll in Medicare. So 2 ways to look at this. One is if you are receiving Social Security when you turn age 65. The way this will work is that Medicare Part A and B are automatic. Now, you can decline Part B if you don't want to have that. When you receive Social Security and you turn 65, the coverage for A and B will start the first of the month you turn age 65. So with Part C and D, now again, Part C is the Medicare Advantage route, and then Part D is part of that original Medicare plan. They're not automatic, because you have to go to the private insurer and proactively enroll, and then you have options you need to make, or decisions you have to make on which type of plan you would prefer to have. Excuse me. So now, if you're not receiving Social Security when you turn age 65, now you have to go proactively sign up through the Social Security Administration during a Medicare enrollment period. And we break these down into 3 different periods. One is the initial enrollment period. And so that's when you're not covered by a group plan at age 65. A special enrollment period, which is where you are covered by a group plan at age 65. And we'll talk about these in a little more detail. Then you have a general enrollment period, which is when you miss your initial or the special enrollment period. Let's break these down a little bit further. So this is an important chart as far as when your coverage starts. So if you sign up before the month you turn age 65, this is the ideal, because the coverage will start when you turn 65. If you wait for the month you turn 65, then your coverage starts the next month, and you may have a gap in coverage. If you wait for 1 month after you turn 65, the coverage will start the next month. And then if you wait 2 or 3 months after you turn age 65, again, the coverage starts the next month. So another way to look at this is that these are the periods where you don't have to deal with the penalties if you sign up for Medicare Part B appropriately. However, you do want to be cognizant of making sure you have coverage. And the best way you can do that is making sure you sign up for this before you turn 65. Now, who signs up for Part A during the initial enrollment period? So let's talk about this a little bit more detail now. So basically, almost everybody who turns 65 will sign up for Part A during the initial enrollment period. There's one big exception to that we'll cover in a minute. What we typically tell our clients to do at this point is to have them check if they're still working, check with their benefits administrator, and they're in that situation where they're covered by a large plan defined as 20 or more employees, and see what their benefits administrator suggests. They may advise you to enroll in Medicare Part A because it may enhance the hospitalization coverage that the employer plan already provides. But the one thing you want to be careful of, and because health savings accounts are becoming more and more popular, is that there's a little nuance in terms of the rules. You don't want to sign up for Part A if the employer plan is a high deductible health plan. And when that happens, it can be paired with a health savings account. And if you want to keep contributing to the HSA, the rule is that you have to stop HSA contribution upon enrollment in Medicare. So if you just do the automatic sign up for Part A, because most of the time there's going to be no premium, it sounds really good. If you're doing the HSA contributions, you don't want to go down that road because you're not going to be eligible anymore to contribute to the HSA account. So now let's talk about who signs up for Medicare B during the initial enrollment period. And so the way this will work is that it's for folks that are not covered by the comprehensive employer plan that covers 20 or more employees when they turn 65. And we'll keep referring to this throughout the webcast because the 20 or more employee requirement is really important. And so who else would sign up for Part B is going to be those that are not working, they're self-employed, they're employed by a company with less than 20 employees, they're on COBRA, maybe they're receiving retiree health benefits, or they're just simply employed by a company whose health plan is less comprehensive than Medicare. So for Part D, signing up during the initial enrollment period, so Part D is the prescription drug coverage. So who will sign up for this? It'll be folks that have signed up for Parts A and B and want to have prescription drug coverage. So similar to Part B is that you want to sign up when you're first eligible, or you could face late enrollment penalties again, just like Part B does. And so the only possibility for avoiding that is unless they're covered by a plan with drug coverage at least as comprehensive, as Medicare. And the formal term for this is called creditable coverage. If that's the case, then you're not going to have the late enrollment penalty. And so again, for the penalty for the late sign up, it's 1% of what they call the national base premium for each month. And so right now that base premium is defined as being $36.78. So your two options, just kind of summarizing this for Part D, is you can have that standalone prescription drug plan, and that's where you choose that original Medicare route. So that's A, B, D, and then the Medigap policy. Or if you're choosing the Medicare Advantage plan route, as long as that plan includes the drug coverage, creditable drug coverage. Most of them do, but they're not required to have the prescription drug coverage. So you just want to make sure that is the case. I don't think I've run across one where it didn't have it, but it can. So you just want to be cognizant of that. Make sure you have the right, make sure you have drug coverage. So let's talk a little more about the special enrollment period. So that goes back to the situation where the individual or their spouse is employed by a company that has 20 or more employees and they have the group health insurance plan. So what happens with the special enrollment period, this is a way to avoid the penalty and then not having to sign up for Part B and Part D whenever you turn age 65. So the way to work for Part B is that special enrollment period is any time before the coverage ends, your current coverage on the group plan. And then you have an 8-month period starting the month the group coverage ends, where you can enroll for Part B and not have to deal with the penalties. You could say retire at age 70 and the group plan, of course, would go away. As long as you follow these rules, that's no problem. You won't have the penalty for signing up for Part B because of this, what they call the special enrollment period. So similar to Part B is there's a special enrollment period for Part D. And again, this is anytime, you can sign up for this anytime before the coverage ends to avoid the penalty. And in this case, you have 63 days after coverage ends with your employer in order to get enrolled for Part D. So there's two different windows here, 8 months for Part B, 63 days for Part D, different deadlines to sign up for in order to avoid the late enrollment penalty. Now, the best time to enroll in Medicare, so to avoid those late enrollment penalties, signing up during the initial or the special enrollment period. And then most importantly, to avoid the gap in coverage, is make sure you sign up before the current coverage ends. So you want to be cognizant of the late enrollment penalties, but from a more practical standpoint, you want to make sure you sign up before the existing coverage ends so there's no gap in coverage. Let's talk about the general enrollment period a little bit more. So what this is for is if you miss that initial enrollment period, there is a general enrollment period which runs from January 1 to March 31. So the way this will work in terms of the starting point, the coverage starts the month after you enroll. So a way to look at this, if you sign up during these months, so January, February, March, which ties into that open enrollment period, the coverage will begin the month after you enroll. So let's do a summary because this gets to be confusing. You have all these different names. They're called enrollment periods, but there's three main ones. You have the initial, special, and general. So for the initial enrollment period, and we've covered this already, but it kind of helps to have this summarized on one slide. So the initial enrollment period for everyone age 65 who's not covered by an employer-sponsored group plan. And again, that covers 20 or more employees. Best time to sign up, 3 months before your 65th birthday. And in those scenarios, the coverage will start the first of the month you turn age 65. Special enrollment period, which we just covered, that's for anyone over 65 who is a current worker or a spouse of a current worker under a large, again, defined by 20 or more employees, group plan. Best time to sign up before the coverage ends. And then the coverage will start the first of the month of enrollment or the first of the month following enrollment if later. And then kind of the catch-all is that general enrollment period. So for anybody that misses that period for the initial enrollment or doesn't have the special enrollment, then they have a general period that runs from January 1 to March 31 with coverage starting the month after you enroll. And we will make these slides available. That'll help you refer back to them because the rules are they're just confusing and you don't want to make a mistake going through this process. Now, how do you sign up for Medicare Part A and B? As I mentioned, I think it was on like the first slide. It doesn't make sense at first, but you go to the Social Security website in order to apply. And so there will be, once you go onto the site, there's a section for applying for Medicare benefits. You can call Social Security. This is the phone number you would want to reach. And then the Medicare website is very good. It's a pretty good site in terms of getting information. So this is the link for the website. Has a lot of really good information on it. Goes even in a little more detail, certainly, than what I'm covering on the webcast. So now, how to sign up for Medicare Part D. So Part D, again, is the prescription drug coverage. So the first thing you need to do is thinking about on that one main slide is you want to decide if you want original Medicare, that's Part A, B, and D, along with Medigap, or you're choosing the Medicare Advantage plan route. So that's the first thing you want to do. And then what you can do is you can apply for Part D through the private insurer, or you can go through Medicare at their website, and then there's also a phone number for that purpose. Let's talk a little more about Medicare and private insurance. So we've been talking a lot about Medicare itself. Let's take a little bit of a deeper dive into the private companies. So as far as the out-of-pocket cost goes, you're going to have a premium So the Part B premiums are paid to Medicare. But on that private insurance front, you're going to have to pay premiums for Part D plus the Medigap policy, or you're going to pay the premium to the Medicare Advantage plan. So again, this is right here is the original Medicare route, and this is the Medicare Advantage plan route. So other out-of-pocket costs that you're going to have exposure to, and we'll get into the numbers in just a slide or two, is you can have deductibles, you can have parts of doctor bills not paid by Medicare, and then just overall, there can be services that are not covered by Medicare. Let's talk about those monthly premiums. So for the most part, a lot of people do not pay any premium for Medicare, but that is only if the spouse, or if yourself or spouse paid into Social Security 40 or more quarters, which translates into 10 years. If that is the case, no premium at all. However, it gets a little costly. So if you paid in 30 to 39 quarters, the premium is $285 per month. And if it's less than 30 quarters, you have to pay $518 per month. Now with Medicare B, the premium for this year, if you're starting this year in Medicare B, that premium is $185 per month for 2025. And then there's what's called an income-related adjustment. And so we're going to cover that on a separate slide as far as what that means and who that could apply to. So over to Medicare D, we know now that has to be paid to a private insurer. There's no set amount. It varies with the plan, and there are thousands of plans in existence. Whenever we run projections for clients, we'll run it typically at $40 a month. As I mentioned on an earlier slide, the national base premium that was referred to, that amount was, I think it was $36.25 per month. But you can get plans that are less costly. You certainly can get them that are more costly. But that's why we don't have an amount here, because it just depends on which plan you choose. With Medicare B, there's only one Medicare B plan. So that's why the premium is set for everybody if you're starting this year. Now with Part D, there's also this income-related adjustment that applies, which we'll cover separately. And that's what this slide actually gets into. So it's pretty noisy, a lot of columns. I'll just try to focus on one example, and then you'll have a better idea about how to read the chart. So this will apply for Parts B and D for the year 2025. So the way you want to read this, and I'll pick, let's pick an example. I'll just go through the first row. So the first thing is, let's talk about the columns. When you see the term MAGI, that stands for Modified Adjusted Gross Income, which is a number based upon your tax return. And most of the time, this number will be the same as adjusted gross income on your return. So the way this works, we have that number for a single filer, for a joint filer, and for married filing separately and living with a spouse. So the way you want to read this is that if and I'll refer to it as just MAGI, is $106,000 or less. You can see for joint $212,000. For married filing separately, $106,000. Under those amounts, you don't pay any additional what they call income-related adjustment amount. You will pay Part B, which we covered on the prior slide, at $185 per month. The Part B, and then this income-related adjustment amount is referred to as IRMA, just kind of an acronym for it. It's a big zero there, which is good, so there's no extra amount being paid. Part D for IRMA is going to be zero, because again, you're under these thresholds. And so as a result, the total Part B and D premium is going to be the $185 per month, which is just simply taking these three numbers across and adding them together. We can look at a more extreme scenario where we have the income being for single between $200,001 to almost $500,000. You can see for joint, you can see for married filing separately. So the way you read this, the base premium for Part B doesn't change. It's $185 for anybody starting this year. However, you can now see there's an additional almost $407 per month being paid, and for Part B. And then for Part D, it's almost an additional $79. And so in this situation, the total Part B and D premium plus that IRMA amount is now $670.50, just taking these three numbers and adding them across. They're also pretty big high dollar amounts in terms of income. So you can kind of work your way through down to this level, just focusing on single just for right now. $185 per month. That first bump up is $74 per month for Part B. Part D, $13.70 per month. And then you can see the total is $272.70 per month. So when you compare, then we'll call it the non-IRMA amount, you have a total of $185 per month. And then for once you get bumped up to that next level, you can see it goes up by not quite $100, but pretty close to it. And so when you're doing kind of year-to-year tax planning, if you have flexibility, again, we'll just focus on the single column. And let's say your MAGI, modified adjusted gross income, is approaching this level, and you can make a decision maybe to defer some income to the following year. Go ahead and do it, because if you don't and you bump into this range, you just cost yourself another, let's just call it an additional $100 per month or $1,200 per year. So that's the situation when you hear about IRMA. That's what we're talking about. And then you get to see there's different ranges and different premium amounts, that will apply. And the additional payment overall is reflected in this last column. So now we're going to talk about deductibles, so the amounts you are going to pay. So for Part A, you will pay $1,676 per spell of illness. And these amounts are adjusted each year for inflation. Part B, the deductible is $257 per year. And you can see it's waived for some kind of more proactive screenings, flu shots, for example. Part D, prescription drug coverage, it's $590 per year. So let's talk about coinsurance. So for Part A, hospital coinsurance is $419 for days 61 to 90. It goes up to $838 for days 91 to 150. And then you can see there is some coverage for skilled nursing. You have the coinsurance of $209.50 per day that you need to pay for days 21 to 100. So over to Part B, you have what are called assigned claims, which is 20% of the Medicare approved rate. And then you have what's called unassigned claims. And so this is 20% of the approved rate plus the balance of the actual charge, and it's capped up to an additional 15% of the approved charge. So there's a situation where you go to the doctor, you want to make sure you understand whether the claims are going to be deemed to be assigned or unassigned. If they're assigned, then you're going to be capped at that 20% amount of Medicare approved rate. Unassigned claims, you have potentially an additional 15% of the approved charge. So let's talk about Part D. So that again is prescription drug coverage, and we'll talk about coinsurance. So the way this will work, we covered this on a couple of slides ago, but just to kind of summarize Part D, is you have the $590 deductible, and this is all on top of the premium you're paying. And then you will pay 25% of the drug cost after the $590 has been met. And then you will just kind of run the numbers through until you are exposed or have out-of-pocket costs that have reached $2,000. Once you get to that point, above and beyond that, there's no further coverage or cost, for your covered drugs on your Part D plan. So, and there are literally thousands of plans out there. So you want to just go through this. Probably the most important thing is you want to make sure you look at what's called their formulary. If you're already on some drugs, you want to make sure that those are covered, and on the formulary will be a list of what is covered by that policy. So that's one. When you're shopping these plans, that is certainly the first thing you want to cover and make sure is that any drugs you're taking are covered under that plan. And then because there's just so many plans out there, you will see a pretty wide range of costs. Although, normally it doesn't go above $40 a month, but, below that, you can have pretty wide range. Okay, so we'll talk just kind of summarizing, what Medicare covers. And so Medicare covers the first 60 days of a hospital stay. As far as the medical services, like doctor visits, outpatient, it's 80%. Medicare covers 80% of the Medicare approved amount. And then some preventive services, again, flu shot being an example, is covered by Medicare. Maybe more importantly is what Medicare does not cover. And so it does not cover long-term care. That's the biggest one that always comes up in discussion. It does not cover care delivered outside the U.S. It does not cover dental, vision, hearing aids. Probably some of the other ones aren't as surprising, but it doesn't cover cosmetic surgery, acupuncture. It doesn't cover amounts over a Medicare approved amount. And it does not cover the amounts not covered by deductibles and co-insurance, the 20% amount. But this is really the big one that always comes up in discussion and where there can be a lot of confusion on is surrounding long-term care. So let's talk about what private insurance may cover in full or part. So private insurance can cover deductibles and co-insurance amounts. We've covered some of those already. So one example would be that Part A deductible, the hospital cost after 60 days. If you recall, there's a payment amount you're going to be required to pay. That 20% of doctor bills that Medicare doesn't pay, and any amount the doctor charges over the Medicare approved amount. So there's some additional coverage you can get to help with this. On prescription drugs, it may cover the deductible, and then it may cover some of the cost or most of the cost of certain drugs during that initial benefit period and that catastrophic coverage period. And that's where you're in that, they call this much anymore, but the donut hole. And that's where you're paying the cost. Once you reach that $2,000 out-of-pocket cost, then you're clear and everything is covered. So there could be some insurance to help cover some of those gaps. So with that, we're going to talk about Medigap, sometimes referred to as a Medicare supplement insurance. So this, again, is part of that original Medicare coverage where you're choosing A, B, and D for prescription drug coverage. And so these are private health insurance policies sold by private insurance companies. So there are some federal and state laws that will protect you through this process, and we'll dive into that in just a second. So with Medigap, they are what we'll call standardized policies. And so you may have seen the big chart, which I think is on the next slide, where it breaks out the different letters. And then each one of those letters covers different types of coverage. And so that's what we're talking about here. So the standardized part of this is going to be that what the policies cover by letter is going to be the same no matter where you live. If you're in these 3 states, there could be a little bit of a difference on some of the standardizing of those plans. One big thing with Medigap is that it does not work with Medicare Advantage. If you recall from what I'll call the main slide, we had option 1 on the left was Medicare, and over on the right was Medicare Advantage. You can't have both plans, and that's really what this is referring to. So with Medigap, you will pay a monthly premium. And so the key thing is that the cost can vary by plan, by company, and by location, meaning where you live. But what is covered by the plan is going to be standardized unless you're in these 3 states, and you have to be cognizant of that. So this is the chart that you may or may not have seen. It's confusing. It's overwhelming. There's letters, there's percentages, there's benefits. So let's try to break this down a little bit more. So on the left-hand side of the screen, we have the Medigap benefits. Now, first, just kind of cover this at sort of a 30,000-foot view. So that's these benefits here. And these are the different letters that I was referring to before. Now, you will see that there are some letters that are missing. It's not a mistake. It's not a typo. You don't see one for Part E or Plan E. and that's because it just doesn't exist anymore. This has gone through a lot of changes over the years. And then you will see kind of matching up, for example, in let's just look at Plan C. You will see that each one of these benefits can have a different percentage amount as far as what's going to be covered by it. In this particular plan, you will see that Part C or Plan C covers 100% all the way down to here. It doesn't cover anything in this box for Medicare Part B excess charges, and then it only covers 80% of foreign travel emergency. Now, unfortunately, Plan C and F, they're not available any longer for anybody new to Medicare. That started back in 2020. If you had Plan C and Plan F going into this year and you've maintained it, you still may have Plan C or Plan F, which is why it's left on this chart. So let's look through the remaining plans. And so the way this will work is, let's just go through the benefits. So if you recall going through Part A and Part B, there was some co-insurance, some deductibles you're responsible for. If you have one of these policies, it may help cover those. And that's why it's called Medigap. It's kind of the gaps within Part A and Part B that leave you out of pocket. So you can see for this one, Medicare Part A co-insurance and hospital costs up to an additional 365 days after Medicare benefits are used up. That's what this covers on this benefit. And if you just kind of go all the way across, you can see every plan covers 100% of that. Then you start to run into some differences. Medicare Part B, the co-insurance or co-payment amount, which we covered on that one slide, most plans covered at 100%. However, when you get the plan K and L, the percentages are lower. And then plans M and N covered at 100%. So as you kind of, I won't go through each row on this, but you can see in every one of these boxes, blood for the first 3 pints is covered almost entirely, except for, again, plan K and L. Part A, hospice care, co-insurance or co-payment. And again, the way you want to read this is just kind of roll right across and see how much is covered. Now, when you get down to skilled nursing facility care co-insurance, you'll see plans A and B, there's nothing in there. There is no coverage whatsoever. And then as you roll through the rest of the plans, you can see the respective percentages. Again, K and L have less coverage for that. That Medicare A deductible, you can see there's 2 plans, A and M, where there's no coverage, and you can see the respective percentages. The Medicare Part B deductible, there are only 2 plans that cover it, and those are the 2 plans that no longer exist. But if you still have it, you still have that coverage. And so there's no other coverage provided by any other policy. That amount was, I think, was $257 this year. So not a huge number, but still something you're responsible for. The Medicare B excess charges, only these plans cover. That's F and G. And then foreign travel emergency, no plan covers it at 100%. These plans don't cover it at all. And then the remaining plans cover it at 80%. And that can be an important one in the case of anybody that's doing more travel, to at least have some level of coverage. So it's confusing. This is a bit overwhelming. This one requires a little more studying in terms of seeing what makes the most sense for you. And your most comprehensive plan today is going to be Plan G. So if you look at this, 100% coverage all the way down to here, doesn't cover the Medicare B deductible, covers 100% of the Medicare Part B excess charge and 80% of foreign travel. So as you probably would expect, this is going to be the most costly premium. And then if you go to, and I don't know which one will be the least costly, it's probably going to be K and L because of these reduced percentages, even though they cover some things that Plan A doesn't cover, for example. But that's where you just want to get the quotes, see what the numbers are, and make a decision based upon that, based upon the coverage that you need or feel comfortable with. So as if that's not overwhelming enough, let's move on to the next slide and talk a little bit further about Medicare Advantage plans. And so with this, these are plans, they're approved by Medicare. So there is coordination happening here. You'll hear it referred to as Medicare Advantage or Part C. This is one of the ones where if you're going into open enrollment, you have probably received hundreds or dozens of these mailers by these companies. So the way it works kind of behind the scenes, Medicare pays an amount to the insurance company for each member's care. And then what the insurance company is doing, they're wrapping it all into one policy, one premium that you have to pay. So part of that, what you're paying that premium is for Medicare Part B. And really Medicare, even though there's typically no premium involved. So the way Medicare Advantage plans work is you have to use the network of doctors or hospitals, just like what I'll call traditional health insurance, PPO, HMO, runs very similar to that. And so the plans may include, and most of the time do include, that prescription drug coverage. One of the nice things on these plans is that it can include extra benefits like vision or dental, be wrapped all into one policy. So with health insurance, the differences in plans can be all over the place. And in this case, that's still the case with Medicare Advantage. Benefits, cost sharing amounts can be different. So you have to do a lot of shopping with these plans. You can run up high deductible plans. Some tout zero premiums because your deductible is really high. So if you're healthy and you want to lower the premium amount, that's a way you can do that. So you have a little more cost control with these type of plans. And just like everything else, you want to shop carefully, just kind of summarizing what we've already talked about in these last few slides. So those Medigap plans, that's the chart with the different letters. I was showing you Plan A, for example. Plan A has the same coverage amounts no matter where you live. The premiums can vary quite a bit. So going with a reputable company, as with any decision, is really good, especially when it deals with health insurance. The drug plan benefits can vary a lot because there's thousands of plans out there. Just make sure the medicines you are taking are covered by that plan you ultimately settle with. And then on the Medicare Advantage plans or Part C, the plans can vary quite a bit. So again, you need to spend time understanding the policies and figuring out the best fit for it. When we get into these situations for shopping, we do work with different health insurance brokers we've built relationships up with over time. And if a client happens to want to have some additional help with it, we'll provide them with several names that they can reach out to and find a really good fit. And they can walk through some more of the granular detail of these various medical insurance plans. So with that, we're going to hop over to questions and answers. I realize that this can be a lot of information to go through. And, that's why we make these slides available so that you can have, time to really sort through everything the best you can. One of the things that, just to build on to a little bit further between the differences on Medicare and the Medicare Advantage route is that with the Medicare route, it seems like it's a little more complicated because you have A, B, D, and a Medigap policy. And I think that's a fair statement to make. But one of the benefits of Medicare is that if you're traveling and you have, you have the need to see a doctor, you're going to be able to find a Medicare doctor most likely wherever you are in the United States. So that's an important factor. With Medicare Advantage, a big difference between that and Medicare is that depending on the company that you're working with, then you want to be careful of the coverage. So for example, if it's with a big regional carrier, then you may only have coverage in a certain part of the United States, maybe just in the Northeast, for example. If it's a nationwide carrier like United Healthcare, I'm just throwing that out as one example, not a recommendation, then you will have more coverage, but probably not coverage throughout the U.S. And so that's a really important distinction between the two. So you want to make sure that your network in that case is going to be covered. And if you're traveling or doing a lot of traveling, maybe you have family living in different parts of the country, it's areas you may spend more time in. The Medicare Advantage plan it just requires more due diligence and reviewing to make sure that would be the route that you would want to go. So You don't want to just look at the premium. You don't just want to look at the kind of ease by having a Medicare Advantage plan all everything wrapped into one. That sounds great. You do want to make sure, of course, at the end of the day, you're going to have the coverage that makes the most sense for you. So with that, just kind of going through some of the questions that we have. Excuse me. With one of the questions has to do with why would people want to have that plan K or L? So that was the one that had the lesser benefits, tied to it as like 50 and 75% throughout. They would be, all things equal, would be a less expensive plan. Of course, you're getting less coverage with that. But it is good from that standpoint. You can at least control your costs that way. And that's why they keep those options out there, is that maybe you just don't need some of those benefits that are covered less or not covered at all by those plans. And so you want to at least get everything quoted out and see how much it's going to cost and then compare and contrast. Let's see. So the next question is regarding healthcare brokers. Are they generally tied to one insurance company or another, or is their advice independent and they look across a wide range of insurers and plans? And that's a really good question. And so with the folks that we've worked with, they are brokers, meaning they do shop the market. It's not like they're an agent tied to just one company. Those certainly, exist in terms of who you can work with, but we certainly prefer the broker route just so that they're shopping the market more and just getting, a wide range of quotes, perhaps on just say a Medicare Advantage plan. And that way for anybody working with them, they at least have, those kind of options available, at their fingertips. Another question had to do with a lot of the problems that United Healthcare has gone through recently. Of course, if you remember, their CEO was assassinated, and they've had some financial difficulties from that. We haven't seen any problems with their Medicare Advantage plan that they have through AARP that they kind of coordinate with. So I haven't seen any direct issues related to the assassination that occurred. Or just even some of the financial, their stock price, I know, struggled after that occurred. There hasn't been any stories that I've seen in terms of problems with their policies themselves. But just like with anything else, I mean, you want to do your due diligence review, and when you're working with hopefully a health insurance broker or somebody that can guide you through, they can give you certainly more experienced answers based on what they're seeing across their client base. But it's a good question. It's a fast-moving industry. Another question had to do with just all of the changes going on with health insurance. There's a lot of discussion right now about the Affordable Care Act, the subsidies, things like that. And has there been any sort of negative impact with kind of the battles going on politically in Congress right now? And not so much the Medicare Advantage plans. I haven't really seen any issues with that, or even Medigap plans, with it. But there are some, underlying cost increases that are happening that certainly these plans can be subject to. But it's not really kind of caught in the battles going on right now. That's more surrounding the Affordable Care Act that we're hearing more about on a day-to-day basis. Yeah, let's see. So another question dealing with as far as the enrollment period and when to start. The best, and I'm just going to scroll back a little bit through the slides. I'm just going to go back to the one where we talk about the enrollment periods, because it's a really good question and one you want to be careful of. And so that initial enrollment period before turning age 65, that best time to sign up right here. So 3 months before your 65th birthday, so that you can have the coverage starting the first of the month when you turn age 65. And I mentioned on another slide, you can run into situations where you don't do this. You may not be able to get any coverage if you're not working with an employer plan. It can be hard to find insurance companies that write a policy for somebody turning age 65, sort of like a standalone policy, because the idea is Medicare is kind of a nationwide program, as I talked about on, I think, the first slide. And the intention is for everybody to, sign up for that. And so you have sort of like a dried up market, if you will, for insurance companies. There may be some that have plans for those 65 and over, but you got to be really careful with that because there just may not be options. So bottom line on that question is just sign up in that 3-month period before your 65th birthday. And I do it as soon as you can. Just allow for any problems or any mistakes that may happen along the way. Give yourself as much time as possible with it. Just wait another minute to see if there's any other questions. And certainly, if you have any specific questions, feel free to set up a call, with myself. We can talk through the situation, and hopefully between that and having a copy of these slides, and then maybe working with somebody to get into the more contract details for insurance policies, you should be in really good shape. But I think what I've found over the years is that the slide that I covered towards the very beginning, if you're going to get any slide that really spend the most time on, it's going to be this one. If you can understand that the differences between original Medicare, Medicare Advantage, and Part C, if you can separate the two, understand they're two separate tracks to get coverage, and you can't have both at the same time, and understanding that and getting used to these terms, that's going to set you up really well. Because if you don't get this, you understand how these two work, and you start hearing about Medigap, and then you hear about Medicare Advantage, and they all start to run together and sound the same. So you can kind of reduce confusion by keeping this slide at your fingertips and understanding the differences between the two. And I know that mailings are just, there's so many mailings that get sent out this time of year, and that also can add confusion to the process. Okay, looks like that's it as far as questions go. So I really appreciate everybody attending, and I'm going to turn it back over to Dan.
Great. Thank you, Jim. And I want to thank everybody for joining us today for the webcast. Thank you again for attending and have a great day.